back. The effects of Hurricane Beryl are still fresh for so many, and we still have months left of hurricane season to go. The stress of it all impacts our hearts, and some research actually shows that heart attacks, stroke, high blood pressure, and heart disease all increase following major hurricanes. Here to share more is Dr. Khashayar Hematpour, an electrophysiologist with UTHealth Houston and Memorial Hermann. He's going to help us understand, how our heart works. Thank you, doctor, for being here with us.
Thank you, Sophia. Always happy to be here.
Okay, so let's talk about a number of studies have really shown that hurricanes can cause a lot of stress, right? So people can really experience some serious heart issues.
Exactly. We saw after Hurricane Katrina and Hurricane Sandy in 2012 that the rates of heart attacks went up by 5-fold.
Wow.
So there is growing evidence that the stress induced by these hurricanes can cause high blood pressure, diabetes, all sorts of cardiac diseases include heart attacks, arrhythmias, stroke, and congestive heart failure.
So this is really from stress, right? I mean, hurricanes cause a huge amount of stress, and people are worried about their homes and flooding and safety, but stress from everyday life can also...
That is correct. The mechanism can be explained by a hormone that is produced by our body, and it's essential for our daily activities. When we face stress, the adrenal glands produce a group of hormones which are called catecholamines. What they do, they prepare your body for that so-called fight or flight mechanism. They raise your blood pressure, they redirect the blood from the internal organs to the brain, heart, and muscles. So as a result, muscles become stronger, your mental alertness goes up, your cardiac outputs is higher, so you're ready to face the stress.
Yeah.
Problem happens when these hormones stay up for several days. So those effects become chronic and sustained and turn into a disease rather than a normal phenomena that's supposed to be productive and protective for you, actually.
Okay, so there's a difference if it's like performance anxiety or if you have to give a presentation at work or you're kind of stressed, but we're talking a chronic condition. That's when you're going to start seeing the really negative effects.
That's true. And it's very interesting that these numbers, like the elevated number of heart attacks, have been seen up to months or years after the hurricanes, suggesting that these effects sustain for a long time, especially elderly and, for example, underprivileged neighborhoods are at higher risk for these effects.
Okay, hurricane season is still, we're just getting into it, right? We've got months left to go. So what can people do to prevent, any kind of stress on their hearts and their bodies?
There are things that they can do. Always prepare early, manage stress, which is not easy, but there are things that they can do to overcome that. Maintain medication supply, very important. Remain hydrated, eat well, drink well, and pay attention to your symptoms, the most important.
Your body, right? Okay, so what are some of the symptoms that we got to go see someone? You have to get help now. What maybe even just building up to that point.
I always tell my patients that the symptom severity is a range. So it's not just chest pain, which most people think, but it can be fatigue, dizziness, not any fatigue, unusual fatigue, dizziness, shortness of breath, irregular heartbeats, and things like ankle swelling.
Okay.
So if you see these, you have to seek medical care.
Okay. We're also seeing people dealing without power, right? And people dealing with, extreme heat throughout the power outages last week and the week before. What kind of strain does extreme heat play on our bodies and our hearts?
Extreme heat can cause electrolyte imbalance. It can cause irregular heartbeats. Then if it's too long, it causes a condition named heat stroke, which is a true medical emergency. And it's very dangerous.
When you talk about being hydrated, would you recommend salts? Is that a part of it, like a Gatorade or anything with the electrolytes,
yes,
that sort of thing?
That's true. Not just water with electrolytes. Not necessarily salt, because some people may have high blood pressure and that salt may not be productive and may worsen the high blood pressure for them.
Can you explain to us about an electrophysiologist? Because it's kind of like the electrician for the heart, right?
Yes.
So if somebody comes sees you, they may need a pacemaker.
That is correct. So we are heart rhythm specialists. Basically, we call ourselves electricians of the heart or pacemaker doctors. So if there's irregular heart rhythm or irregular heartbeats, that's when we come into picture and help regulate those by adjusting different pathways in the heart by either burning or freezing them or maybe just by medications.
That's incredible technology. And if folks, maybe just want to learn more about their bodies, maybe not having such severe symptoms that people get during the hurricane, would you recommend getting a checkup like an EKG just to see if if their heart's going through stuff, depending on age, I guess?
Well, that's a very good point. It's good, especially if you have underlying conditions, to meet your doctor before these things, if you had enough heads up and warning to adjust your medications and prepare you for this situation. Yes.
Yeah. Dr. Cash, thank you so much
for
your insight. Stay hydrated, manage that stress.
Absolutely.
The biggest things. All right, Dr. Cash, thank you for being with us.
Thank you.